Hey, what's up? Barnaby here. So you're interested in knowing more about anxiety disorders? Well, you're in the right place. It is a smart living network. HelloLife.net, and joining me is Dr. Jeffrey Chamberlain, family medicine specialist. We've been talking at length about anxiety disorders, and there's a wealth of information on this website that you can click around and see which one pertains specifically to you or a loved one. But a lot of the questions that we get are about the cure, if you will. Is it possible to get over, to be cured of an anxiety disorder?
And this is a really good question, and I'd say it depends. I have a general theory in medicine. I've never been taught it in the books, but I've just been experiencing things enough where you see these patterns where if there's a medical condition or an issue that someone has that's recently just popped up, it's easier to get rid of it, where if it's an issue that's been going on for a long time, a lot of times it's a really long road to get rid of this. And this is true from anywhere from having high blood pressure or weight gain to anxiety. And someone who hasn't had issues with anxiety and then had a traumatic event happen is more likely to bounce back pretty quickly than someone who had a lot of traumatic things happening from when they were a kid, their dad dying, and these other issues, and now they're in their 20s, 30s, 40s, 50s. Right. It'll be a lot harder for them to deal with it and get over it.
Well, it's interesting because it does, again, fall to us to take action and not to think, well, it'll just go away.
Yeah. That's really true. I recently had one of my patients who's a new mom, and she has some obsessive compulsive disorder tendencies, and these have been going on for a long time, but she always just hid it. She never really dealt with it. She never talked to me about it, but she just kind of tried to hide it from people, and now she has a baby, and her obsessive compulsive disorder plus just all the other issues with hormone changes with having the baby, the stress of the baby, it kind of blew up and went haywire. She came into me crying, and she said she was changing the baby's diaper. She'd change the diaper and then just take it off and throw it away, put another diaper on, throw it. So she's going through like a box of diapers in a day. And she says, I know this is just crazy, but I can't help myself. I can't stop. And so we started working on things there, and she's improving quite a bit. But the earlier we started, the better off she would have been. I have another patient who has a really great job, but has really bad panic attacks and a social anxiety disorder that is at the verge of quitting her job just because she can't handle it anymore. And we're really trying to work through this, but this is a long road for her, where the earlier we get help, the better off she would have been. Right now she's entrenched in her anxiety and panic attacks, and so it's slow progress, but we are making progress, and we can make progress.
But so definitively, can you one day just shed the weight of whatever anxiety is just tamping your spirit down? Can you just say one day, I'm over it now, I can go forth?
Yeah, I would say it can happen. It's probably always going to be there, kind of hiding in the background, but people can learn ways to manage it and learn ways where it's not taking over their life anymore. It's not controlling things anymore. They're controlling their life, not the anxiety.
All right, and if you're thinking, well, what sort of medicines might I take? What sort of therapies might I have to undergo? We've dealt with that in a previous conversation with Dr. Chamberlain, and you can find that in this website that you're on right now, HelloLife.net, because when you click on this website, you've tapped into a smart living network, and everybody wants to have the best life possible, and this is a good place to check in now and again to achieve that goal.